Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia. PUNARJIVAN, Cardio Pulmonary Resuscitation. My Dharma, the impeccable wisdom, the wisdom of every perfect object of the universe. My greatest discovery, DIVYANK, the divine design of nature with which the perfect objects are designed and created. DIVYANK is a reward of 60 years of integrated education. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. To understand Punarjivan, that means a person has accidentally fallen down and met with a cardiac arrest. As a result, the person's heart is not working. And unless he is revived immediately within a minute or two, at the most three, his vital organs could go for damage and there could be permanent thing. So as a result, anyone we meet with an emergency accident and falls down dead and gone has to be revived immediately within few minutes. To understand that, we need to understand the perfect anatomy, physiology, biochemistry, as well as all related subjects of heart to revive the person fully at the earliest. Heart is one of the only organs which starts pumping almost as 2 months of gestation, pregnancy, and beats continuously till person dies. And such a vital organ who does not stop even for a minute remains vital as the seat of survival for rest of the life is very, very vital, and without oxygen, glucose, water and other ingredients for the brain, heart and other vital organs, we cannot live at all. So as a result, this is seat of survival. Each and everything has to be done in such a way that heart function adequately with a blood pressure of 120 by 74, heart rate of 72, cardiac output of 5 liters. As a result, we will have homeostasis, everything perfectly is already taken care by the system, as well as physical health, emotional health, mental health, spiritual health is adequate to make sure that everyone who is born alive has a vital heart, and reviving a cardiac arrest is absolutely essential. From that background, let me explain to you again how vital it is. Now, size and shape of the heart is in DIVYANK ratio, that is the ratio of 3:5. And system of 100 trillion cells using carbohydrate plus oxygen to produce carbon dioxide is carried through superior vena cava and inferior vena cava to the right atrium, and from right atrium it enters the right ventricle through tricuspid valve, and right ventricle to the pulmonary semilunar valve to the lungs for oxygenation. The blue deoxygenated blood, as you can see on top, is converted into the pink red blood, as you can see down in the heart, in the rest lungs, the alveoli, by absorbing oxygen from the atmosphere and putting into hemoglobin, then RBC, and to the whole system for oxygenation and other vital requirements of the body. From lungs, it goes to pulmonary veins, left atrium, mitral valve or bicuspid valve to the left ventricle, aortic arch, aorta, and to all the 100 trillion cells of the body. I have explained, I am making it again because it's very vital. It has to survive. That's designed with DIVYANK only. Then perf in cardiac cycle, as I told you, aortic systole is in the ratio of 1:7. I have already explained. And ventricle systole and ventricle relaxation is in the ratio of 0.3 and 0.5, which is DIVYANK ratio. And blood pressure 120 by 74 and diastolic 120, stroke volume 74, ejection fraction 61.8034. These are all the vital parameters of cardiac cycle, cardiac output, cardiac volume, ejection fraction. All the vitals have to be perfectly fine if you want to be perfectly healthy 24/7 for the rest of your life. without any problem. From that angle, all the vital organs of the heart location is very essential, and that's what I'm trying to explain. Having explained the size, shape, structure, cardiac cycle, cardiac output, and diastolic volume, things like that, now move on. One point again and again, I've been saying very clearly, keep an eye on ECG. It can be easily taken, does not cost much, but if you can produce this kind of ECG with PQRS complex with TU in the ratio of DIVYANK ratio as expected, you can be perfectly healthy for the rest of your life if this particular stage is maintained. That's the reason I've been again and again. This is vital. All the biophysical parameters of the heart are vital. If heart is perfectly normal, we have 5 liters of blood volume. Everything is perfect as far as biochemistry is concerned. Homeostasis will be formed. There will not be any problem whatsoever. Maintaining that is absolutely essential. In spite of maintaining, again, anyone can fall sick and have a cardiac arrest and needs to be revived immediately. And that is the reason this particular video is very, very important from my angle. Now, to make heart function optimally, I have over and over said very clearly, heart, digestive system, and uterus are 3 organs which have 5th level of nervous system, which is not found in other organs because they are very vital and they can be called as a pacemakers. So heart has got conducting system of pacemakers of 10 stages, and to maintain that, sympathetic system plays very important role because sympathetic system is designed with DIVYANK ratio only. There are 14 spinal segments, 28 spinal nerves from these components, and 45 ganglia. That ratio is DIVYANK. So sympathetic system is DIVYANK. As far as cranial parasympathetic is also designed the same way, but vagus plays very important role when it comes to the heart and lungs. And cardiopulmonary function is respiration of both heart and lungs put together. That's what cardio, heart, pulmonary is lungs. And their resuscitation is very, very important because both have to go in hand in hand. One has to absorb oxygen and blood has to carry oxygen and remaining vital element to the entire part of the body automatically. From that angle, perfect autonomic nervous system, sympathetic, parasympathetic, and the conducting system of the cardiac cycle, all that have to be maintained 24/7 to make sure that we can survive all the attacks on the heart without any problem. Having explained A to Z of all the vital structure, length, breadth, in gross structures, subtle structures, and anatomies and other things has been done. Having done that, let's move on to the next stage to prove what has to be done to survive come what may. One thing which I have already shown this particular slide again, when say mouth to mouth breathing, all said and done, does not work at all in a cardiac arrest when subject falls down with heart arrest. Heart is not functioning. When heart does not function, person will stop breathing in and he will also stop heart functioning. There is no breathing, there is no heart functioning, there is no circulation. Blood has come to dead end. And when the blood is in dead end, mouth to mouth breathing of giving oxygen to this does not work except A, B, C. Airway clearance, you can check it up. Breathing clearance, you can check it up. Pulmonary function, you can check it up. But you cannot revive with mouth to mouth breathing. And this is something I'm very clear. I've never seen it functioning anywhere till date. And I'm made to understand by a lot of anesthetists and others, they fail to do it. They use alternate techniques. They don't really depend on this on the table. So since it cannot be done, maybe if the subjects are doing for the sake of people who have fallen down because this is what they know. But I'm sure instead of mouth-to-mouth breathing, there may be something else is happening which is reviving them in the process. What are the different things which are foolproof to make sure instead of wasting time on mouth-to-mouth breathing, we could do those processes at the earliest? What could be the different process? Let's understand that. The first thing which comes to my mind is lift the legs to the higher level. The perfect manual procedure. Lift both the legs comfortably to the higher position. Let blood drain from legs back to the heart through inferior vena cava, and you also make sure that blood comes from superior vena cava from head tail also. That is important. Let the blood flow back to the heart. Why? The stimulus for sinoatrial node, which is the first node of the 10 stages of conducting system, is placed in the right atrium where superior vena cava as well as inferior vena cava open into the heart. Since it is done there, it should function effectively there only. And it's very close to where both the vena cava, superior vena cava and inferior vena cava enter into the right atrium. So venous return pressure is one which is responsible for restarting the whole circulation once again. When returning venous blood touches the sinoatrial node, the heart is likely to start again immediately. Revival of the present becomes logical, conclusive, and at the earliest. So, to make this particular slide to be understood very clearly for the rest of our life, I'm making it very clear once again. Nature has designed heart in such a way that fifth level of nervous system with the 10 stages of conducting system, starting with SA node, is placed in the right atrium where venous blood returns into the right atrium at that particular stage. Stimulus for sinoatrial node, SA node, is venous return pressure, not anything else. That is something over and over I've been saying because that is my understanding, and I cannot find fault with someone who does not agree. I'm glad that I came to realize this even as a medical student years ago, decades ago. And incidentally, the work was done by my own professor, cardiologist, and I'm glad that it was very conclusive. Although particular journal and particular article may or may not be very popular, for me it was very vital, and I use it over and over to make sure it's a venous pressure and stimulus for heart ECG starts before the heart itself into the superior vena cava or inferior vena cava itself. So from that angle, this is very, very important presentation. Key safest way is don't waste time, lift the legs, return the pressure, push the blood back into the heart with as much pressure as possible. Maybe the technique of Bastrika Pranayam is also to design the same thing, or external enhanced pulmonary or cardiopulmonary resuscitation EECP is also designed with the same thing. If that is physically brought in like this, we could get much better results immediately and spontaneously. Since I'm talking of impeccable wisdom, I want common man also become aware of it, and I'm sure the way I'm trying to explain, it should not be difficult for anyone to understand perfect human anatomy, perfect human physiology, perfect human biochemistry, and perfect human psychology clearly. As a result, they could all lead a perfectly healthy, wealthy, happy, long, blissful life. So having explained that mouth-to-mouth breathing is not good, the first very effective, easiest, simplest of all, lift the legs, give it a sport, let the blood come, and try to help start this immediately. If it does immediately, we are through without much of a problem. And that is the reason I am making this for a common man. Whenever it happens, do this immediately. Don't waste time in any other way. Straight away get into that. Okay. Having done that, now we move on to the next stage, which is equally important for every common man to do in case of emergency. That is compressing of the chest. Perfect manual procedure. Please put the heel of one hand in the center of the chest as shown in the picture. Please place the other hand on top of the first hand as you can see in this particular picture. Please interlock the fingers as you can see very clearly. Please compress the chest with the following ratios. The ratio is 100 beats per minute. Depth is 4 to 5 centimeters, 1.5 to 2 inches into the chest. Equal compression and equal relaxation is important. Please change the cardiopulmonary resuscitation every 2 minutes. Please press for sufficient time for resuscitation. If you can recover within a minute, 2, at the most 3, results are excellent. So don't wait, let it happen. Lift the legs, start doing this, and doing this particular thing, you'll find things are automatically happening. Having done that, now we can move on to this particular phase. But this is a technical thing. I will not go into detail because we are going to do defibrillator, for which you need a medical cycle. So as a result, as you find somebody falling down, make it a point that you inform the surrounding hospital or emergency department to come with the resuscitation at the earliest. And when they come with resuscitation and sit, and whatever they think is required, let them get into it. I would not like to get into the stage at this particular thing because it is beyond the common man's function, and my design is for common man. All those specialized technique, I leave it to the nursing students, our experts, our doctors, other things who are expert. Let them take the decision and move on. So this specialized technique is a technical job to be done by the experts, not a common man. It's impossible. So no details is given here, and there are many techniques which are developed because basically everybody is trying to evolve a better and better system to revive people at the earliest. From that angle, I will leave it. Will not discuss too much about it. Let's come to the final stage where the heart is in the center. Cardiopulmonary function in the chest and related both lungs as well as heart. And since cardiopulmonary mean heart and lungs, and their resuscitation is simultaneous to make sure heart is able to get adequate oxygen from the atmosphere, absorbed into the blood, along with all the ingredients are taken to all the vital organs or to all the 100 trillion cells perfectly, so that we can have a perfectly healthy physical, emotional, mental, spiritual, other like that. So maybe that is also one of the reasons many of the people who are into spirituality, they do believe, and many of the Upanishads also talk about it. The soul, the living consciousness, is in the size of a thumb, and it is residing in the heart. I would not go into details of this because that is not been my experience, that I've seen my soul in my heart. I've seen my whole in Muladhara. I brought into ventricles and also into Brahmanadi, and from inside I have seen the entire world with a concentration of all the indriya, senses perfect, mind perfect, intelligence perfect, intuition perfect, and intelligence, and I am able to see the entire world with my Atma, where all the 100 trillion cells with all the organs, whether the atoms, elements, molecules, compounds, cells, are integral part. They are all totally integrated. Maybe that is the reason I am able to produce 8 hertz coherent, predominant frequency throughout the brain with eyes open and eyes closed anywhere and everywhere. That is one rare compliment, and I'm happy. As a result, I've been also able to show if you are in tune with universal consciousness, you are in tune with your Atma and also Paramatma or the God or the divine consciousness, You will have all the secrets of the entire universe within your fingers. As a result, you can resolve A to Z issues automatically, step by step, without much of an effort. From that angle, understanding CPR, forget about mouth to mouth, don't waste time, straightway lift the legs, increase the heart, and then see surviving. And as you start doing that, maybe someone at the same time start compressing the chest and pressing it and reviving it. If these two things, two people can do simultaneously, you can revive those patients very clearly. At the same time, inform the hospital to bring in the assistance to be required to revive any person at the earliest is that. From that angle, I think what I have explained in this particular thing is what is a safe, effective, which a general public can also do in case of emergency. And this is designed for a common man, common level, which is easy to understand, easy to do without any difficulty, step by step. As a result, we can survive. Majority of the people who have fallen because of cardiac arrest, for whatever reason is, and they should be received, recovered at the earliest, and lead a perfect life for the rest of the life. From that angle, this particular video is very, very important. Having explained that, and I think I'll leave it at that, and let's hope everyone is able to understand that instead of wasting time on mouth to mouth, we straight away lift the legs, raise it high, bring the blood back, and then start pumping the heart, give the stimulus for the SNO to start the heart again and revive at the earliest, and wait for other things only when case is required. This is only for a common man's level, and I think I've done my bit. So thank you very much for letting me have the pleasure of explaining things in the light of my simple language for the simple people, because it's meant for a common man. So thank you very much.